And we welcome you all to what we hope is the beginning of an ongoing conversation, as well as perhaps strategizing of how we as a community can face and address and support those whose lives are affected by opiate use and abuse. This program is a joint effort. It is part of the Federated Church of East Arlington, the Collaborative, which are the ones who gave you those bags. If you didn't get a bag when you came in with some materials in Bailey Hall, and the Arlington Renewal Project, and we also thank the Arlington Nursing Service for their support for the reception that will follow this. So we invite you. Our plan is to have this part of things be over by 8:15-ish. And then we will have time to be in Bailey Hall, where there'll be coffee and cookies. We invite you to stay and be able to maybe go up to the panelists individually, talk to each other, and continue the discussion. If you've never been in here in our church, just to point out that there are 3 restrooms. If you go through this door to the right, and let's see. The other thing I want to make a point of telling you is, if you hadn't noticed, there is a camera here. GNAT TV is filming this. It will, at a later date, be aired. So I would just encourage you to bear that in mind when you ask a question. I probably would recommend you not use names or identifying information if you're talking about a specific person, unless you have that person's permission to do so. The other thing is that this microphone, I am going to be the person walking around with it. You do have to use the microphone because it can't be heard without this. The panel has a different microphone that they'll be using, and Bill has a third microphone that he'll be using as our
timekeeper,
time moderator, facilitator. Bill is our facilitator. So without further ado, I'm going to turn it over to Bill Bryan.
Thanks, Kathy, and thanks everybody for being here. What we really want this to be is, rather than you sitting and listening, we want it to be almost an immediate interactive process. So what I'm going to first do is ask the panelists to take no more than a minute, Tim, to introduce yourselves, and then we'll go right into questions. There are no dumb questions. Please feel free to ask whatever on your mind, what your concern is, because we're trying to build a consensus. And as Kathy said, this is just the beginning. This is by no means the end. And plans are already in place for our next meeting. We don't have a date yet in mind, but we have a plan in mind.
Ooh, and can I make one addition to that? Something I forgot because I didn't have it in my hand. In Bailey Hall, there will be this sign-up sheet. If you would like to be included on what emails that go out about follow-up programming that might happen, we would encourage you to put your name and email address. If you do not have email, just put a phone number and we'll let you know, or a snail mail address, and we'll send you something. Thank you.
The other thing is, I said please feel free to ask any question. If there's a little silence from the audience, then I will do my absolute best to spark a question that you either might say, gee, I wish I had asked that, or why did he ask that? But anyways, just to get this conversation flowing. So, Tim, why don't you start off and introduce yourself?
So I'm Tim Stewart. Is this working?
It should be, but it's not. We're going to have to go back.
I think it's working. I'm loud enough. Okay. I'm Tim Stewart, the current principal at Arlington. This is my last year as principal. I've spent, this is my 31st year in Arlington, and I kind of laughed when I first walked in here because I was actually up here in 1992 getting married to my lovely wife Joy, so it's great to be back at the church. I'm very vested in the community. I'm really glad this is happening tonight. And I really look forward to some discussions, because we definitely have a lot of discussions that need to happen from what I see as a principal.
Hi, I'm Joshua Sherman, and I'm a physician at the hospital in Bennington, Southwestern Vermont Medical Center, and also developing the mill here in East Arlington. And some of you may recognize me as the chair of the recent self-study committee for the school. Nice to see you all.
Good evening. My name is Tom Mosier. I'm a lieutenant with the State Police. I currently run the Shasbury Barracks. We are authorized 11 uniformed troopers and 4 patrol commanders. I'm happy to tell you that we have 11 troopers and 4 patrol commanders right now. So it's kind of nice to have a full shift.
Hi folks, I'm Marty Urian. I'm the Executive Director of the Arlington Rescue Squad. In that position for a year and a half, but with the Rescue Squad for the past 16 years. And I'm also happy to be here and part of this discussion.
So, I think I will start it off with a question because Tim, you kind of piqued my interest when you said you've been here for 31 years, and I've known you for almost 31 years, and I know that of anybody in this community, you probably know the kids the best because that's who you've been working with for 31 years, and I'm interested to know what have you seen over those 31 years, changes with the kids, and we'll leave it at that.
Well, one of the biggest changes I've seen, especially as a principal in AD, which I was for 4 years, social media has changed a lot with kids. Their interactions, their activities outside of school. Looking back, we've always had issues with marijuana, experimenting, drinking. Everyone knows that. It's been concerning to me the last couple of years and the staff. Some of the apathy of students, lack of drive. So we're concerned as a staff with what we're seeing lately. We're happy with the direction of our school, the discipline, the respect, but there's a lot of work that needs to be done.
Anybody have a follow-up question to that? Kathy, right here.
Right.
4th row.
Hi, my name is Meredith Levinson. I live in Arlington. I have 2 young children, one of whom is 7 years old at Fisher. Okay, sorry about that. My name is Meredith Levinson. I live here in Arlington. I have 2 young kids, one of whom is a 7-year-old at Fisher Elementary. So I'm very concerned about are there drugs in the schools, particularly at the high school level? Are there hard drugs in the schools? And what are the schools doing for anti-drug education?
Well, one key thing I want everyone to know tonight, and you could ask, I've met almost all the troopers, especially at the high school. The law enforcement we have a great relationship. Just last Friday, we had Detective Wright was in to meet with our crisis team to deal with different situations, social media stuff. But we have a really great relationship. With that being said, to be perfectly clear, as I left school today, it was brought to my attention about vaping is the new thing, okay, which we've dealt with all ages. We just found out, and I just was actually reading tonight because I didn't know what it was, it's Juul vaping. So they're very small, like memory sticks or whatever. So we're going to address that next week as a faculty, because evidently that is happening in our schools. We are very strict with drug use. We take it very seriously. If you read our handbook, it's online. But it's a daily job for the staff and community to look after that. And it's a challenge. Especially when back in the day you could smell a Marlboro cigarette in a bathroom. Okay, now these new Juul things, they don't have that smell, so it's very tough. So I will say that there's a student survey, I forget the name of it right now, but that schools do across the state, and we were ranked one of the lowest, this is according to students, we were ranked one of the lowest for drug use. And we're very proud of that. But it's continual work. But you can never promise, just like I had a conversation with a state trooper, I can never promise you as a principal that our school, the safety of your child, okay, or the drug use. But we work hard at it and we don't turn our backs to things.
Anybody else on the panel want to follow up on that? Question over here? We'll get you a mic.
Hold it way up to your mouth. Yeah.
Last week on Wednesday, I went down to the high school and then I was going to my car and I could see downstairs where the students, their driveway is. I saw two policemen and a girl, and she had a cuffs behind handcuffs, and I thought, what is wrong
Where was this again?
At the high school?
at the high school?
Well, I can tell you no one was cuffed last week. We had an incident, a social media incident. I'm not going to give out any names tonight, but I alerted the police on Wednesday night. And they were great and the situation was dealt with. I am not aware of anyone being cuffed.
It was a girl.
I don't believe that happened. They would have let me know that.
One of the things that we will absolutely promise everybody here, that if you have a question that hasn't been fully answered to your satisfaction, we will follow up on any question and do our utmost to get back to you with the details. And we have a question way in the back.
Wait.
Or a comment.
Hi, my name is Kathy O'Reilly, and I am the public health nurse that is the school liaison for the Vermont Department of Health. Vermont Department, right there? Yeah. I can't just talk like this, can you hear me?
Yes. Better.
Okay. So I'm the school liaison for Bennington County. So in that capacity, I interface with all 3 supervisory unions in Bennington County, providing technical support, data, work with their Medicaid administrative planning and things like that. I believe the survey that Mr. Stewart was referring to is the Youth Risk Behavior Survey, which is done in the state, throughout the state, every 2 years. It was just conducted in November. The results should be probably ready this month. And they are all available on the Vermont Department of Health website. If you are more than welcome to call or email me at the Department of Health in Bennington, you can call their main number, ask for Kathy O'Reilly, and you can be connected with me. I'm more than happy to talk to you.
Thank you, Kat.
Hi, my name is John Caceres. I'm actually from Valley Vista. Curious, why are we here? I mean, I am under the impression that it's an opioid awareness, and I don't know if there's any value in talking about particularly being that the ESP is here, talking about what's happening in Bennington County. If there's any value in talking statistically about increase in use, increase in overdoses, penetration of fentanyl, things like that. To hear that the school has had the lowest, or has the lowest drug use in the state, I guess, is awesome. So, I guess I'm kind of curious, why here? It's great for prevention and awareness, and I presume that to be part of the discussion. So, just serving as a catalyst.
Yeah, I don't want to speak for the panelists, but one of the reasons we're here is for us to come together as a community. We all live in this community, so we're all members of this community. And just trying to get feedback and listen to each other to find out just exactly what are our concerns. And yes, this is opioid-centered because for lack of a better term, that's the drug of the day right now that's getting all the attention. But I think people here are concerned about other drugs as well. But we are focused primarily on the opioid. And maybe, Tom, I don't know if you want to speak to, if you have statistics or...
Well, I brought just a little bit of data about Vermont. I was here specifically to talk about Arlington, Sandgate, and Sunderland. But I did just pull up some data, and maybe the Department of Health, if they have some information, you can feel free to add it. But overdoses in Vermont are 105 in 2016. That's a 28.5% increase from 2015. We have approximately 623,000 people in the state of Vermont. And what I did was I compared it a little bit to New Hampshire, because we're a neighboring state, we're close by, we're about the same size area-wise, but they're about twice the size of us population-wise. They're at 1.3 million. They also had an increase of overdoses of prescription opioids as well as heroin, 13.7% increase in 2015, and they're at 481 for 2016. So that's compared to our 105. So in the state of New Hampshire, they have about double the amount of overdoses as the state of Vermont does. Say again?
But they have doubled the population as well.
Yes, they're at 481, we're at 105.
So they have, so it's twice as much per capita.
Correct. So 4 times as much with twice the population, does that make sense?
Can you talk a little bit about Arlington, Sandgate, Sunderland? Statistics?
Or Tom, or Marty?
Well, I can say on our standpoint, for the Arlington Rescue Squad, we've had, I believe, 1 instance where we've had an actual overdose and needing to use Narcan back in 2017. Other than that,
Just one?
just 1.
Correct. And the data that I pulled in 2017, the state police responded to 2 incidents with drug use and drug overdose in the home, and 2 incidents with alcohol overdose or overuse in the home. So only 2 complaints of each style for the 2017 year.
Maybe someone on the panel could, because the term fentanyl was used. How dangerous is fentanyl?
Want to see Dr.
Get it. I've heard 80 times.
Take this because I got to change the battery because I just noticed the lights on.
Can you all hear me? Okay. There you go. No, I'm good. So, you know, as I mentioned, I'm a hospital doctor. I basically take care of patients when they're sick in the hospital, need to be admitted. Maybe I've met some of you there, hopefully not. You know, it's a strange thing. I think that answering the gentleman in the back, that we should really start with the basics, which is we've all had moments in our lives where we've been in pain. Opiates are a painkiller, and they do have excellent use. They are used for the purposes of controlling pain in both emergency situations, when you've broken your leg skiing or had a tripped on a stairway, but it also is the kind of thing that is used in surgery. It's used for patients at the end of their lives. So one of the things that is a real challenge here is the fact that opiates are an important class of drug that do need to be available for medical purposes. And that includes both emergency moments as well as those who are dealing with chronic pain. To answer the real problem here is that people abuse, there's some people who abuse the opiates. And to be really clear, opiates come in different classes. So you may not know the word opiate, but you probably know the word morphine. Well, morphine is a type of type of opioid, and same thing is true with fentanyl, which was brought up. What is that? Fentanyl, F-E-N-T-A-N-Y-L, fentanyl, and but once again, it's really these are not drugs that should necessarily be in the home unless they are prescribed by a doctor. I think one of the challenges here, whether it's talking about alcohol or cigarettes and tobacco, or talking about opiates, is that that these do have an addictive quality to them. There is a huge risk for both addiction and abuse. And I think that really trying to sort of go back to the basics and talk about how can we work together as a community. When you ask, why are we here? The reason we're here is because Tim is a great guy and he really cares about the students in his school. But he is not living with the students. He's not their parents. He is not, their grandparents. He's not their guardian. This is something that we as a community have to acknowledge is at home. It does start before high school in certain homes. When you talked about your 7-year-old and you're concerned about what's it like in the high school, well, the truth is that there are a lot of challenges that happen before high school, and those types of things need to be addressed. But it doesn't just happen in school. This is something that we as a community need to address about how can we educate ourselves, educate our kids, our friends, sometimes our parents. How do we sort of work together with the educational system, with law enforcement, with doctors and nurses and other healthcare providers to create a healthier and safer environment? So I think that's sort of the beginning of the discussion, is recognizing that these are painkillers, for lack of better terms. They are good painkillers when used appropriately in a medical setting, and unfortunately, it is the abuse of these that is the real challenge. Yes, sir.
In the home about 2 years ago. About 2 years ago, I had a new knee replacement. I went to one doctor, and the doctor gave me 69. What do they call it? Oxycodone? Yes, oxycodone. I said, what do I need these for? He said, well, you might have pain, right? So I wasn't too happy with this doctor for giving me these pills. I went to another doctor who performed the surgery, gave me another 60-some tablets. So it seemed to me like, boy, if I had taken all of these, I'd be in Lulu World. I probably am anyway, but still. No, seriously now. I think we have to be more conscious of our own medical system sometimes that gives out these things by prescription or whatever case. So I'm not saying there aren't other causes, but that could be one thing we have to be cautious of. I took 2 pills, and that was the end of it. I got rid of them, I threw them out. But there you go. Thank you, Kathy.
I saw a lot of head shaking, so I'm not going to embarrass anybody by a show of hands, but how many other people were prescribed that many? I know I was, and I'm not asking, but I think that's probably pretty typical. However, I can also tell you, and I'm not in the medical field, that that's changing. And Tim, you were talking about that earlier.
Yeah, just a quick story. My youngest son had his wisdom teeth out a couple weeks ago. Is that better? Yeah. Sorry. I don't have to use these at school, but my son had his wisdom teeth out, and instead of like when I had mine out, where I got like 20 tablets or whatever it was, I believe he got 4 tablets. And he was encouraged, with my wife, we're both there. The doctor said all he needs is a half a night until he feels better. So to me, that's a positive change.
In 2017, the state of Vermont passed legislation that limits the amount of pills we can give at any given time. We are allowed to give out a 7-day supply for, I believe it's 21 pills at this point in time, and then if the patient needs additional medication, they have to come back to the doctor in order to get a script. So certainly things have taken a huge about face about nobody's going to hand you 60 oxycodones in the state of Vermont today.
And I think, I don't want to revisit the past, but I think it was so much different years ago that we used to call it doctor shopping. People would go, who were seeking the high, would visit many other doctors and get the same prescription. I got a toothache, I got a earache, I got this, just to feed the addiction. And today, with technology the way that it is, it's much harder for somebody to do that now because doctors are required, I believe, and correct me if I'm wrong, doctors now who are making prescriptions are required to enter those electronically. And if another doctor tried to enter it for the same patient, a red flag would come up or some sort of warning.
Yeah, just to keep it very simple, there is a registration system. There is a better way of sort of computer-wide tracking through both doctors and pharmacies and insurance companies to basically say, you've already had that prescription filled. I'm sure everyone in the audience here has had that frustrating moment where it's the 28th or 29th day of the month. You want to go pick up your pills for the next month and they basically say, well, you're not ready yet or you have to come back tomorrow. Well, that has been instituted for the use of painkillers and opiates in a much more extreme way, which is, once again, to try and help protect people from abusing the system and abusing the drugs.
I just wanted to add something small about the database that the doctor just spoke of. I worked with prescription frauds for the last 3 years prior to coming to Shasberry. And one of the things that we dealt with on my side of the house was the state of Vermont and many other states in the nation only spoke to each other. The state of Vermont spoke to the state of Vermont. So if somebody went to get a prescription over in New Hampshire or New York or Massachusetts or Connecticut, Vermont didn't know about it. Well, that has since changed. So last year that all rolled out. Somebody in the back might be able to give you an exact date on when that rolled out. But now we have several states that all speak to each other. So somebody that was trying to abuse those drugs and go from New York, Connecticut, New Hampshire, they can't do that anymore. Or at least it's much, much more difficult.
I'm Marilyn Couture. I'm a resident of Sunderland. When you're driving and you're near schools and you see the sign drug-free school zone, what does that mean? I mean, a school, I would assume, would be a drug.
Well,
I've never understood what that sign means.
That's the hope.
Yeah.
And if they, I'm not a policeman, but if they get, the fine is stiffer, correct?
We also have maybe the state's attorney would like to chime in.
Where is it? Is Erica here? Go ahead, Erica.
The drug-free zones it was really an initiative by the federal government. It's a violation of state, but also federal law to be providing drugs within a certain number of feet of any school. So that's, I think, why we ended up with all the signs was it was some initiative, both at the state and federal level, to make sure people knew now you're within a school zone. I don't know that it's as much of a deterrent as it makes us feel better that we have this drug-free zone. I don't want to jump ahead of anybody if there were other questions, but I just had a few things that I thought would be helpful informationally. We're here to talk about opioids, and I know there are some folks that were at the Manchester Forum, and I just want to say that I'm thrilled, and I read the youth report that talks about drug use, and it breaks it down actually into different drugs in different geographic locations. And Arlington does do very well on those, but the concern that I have is all of Bennington County. And for Vermont, for the state of Vermont, we had 109 fatal overdose deaths in Vermont last year. In 1 week, because I get a notice at the end of every week, In just the week of February 18th, we had 9 overdoses in the state of Vermont. 2 of them were fatal. 7 of them were not fatal. One of the fatal ones was in Bennington County. I just think that it's important that we have this conversation because particularly the folks that are involved with Fed Up that I've spoken with a number of times, it's frustrating that there is some sense that this drug is not in our community because we're not maybe seeing it in the schools, we're not making arrests on the street corner. The drugs are here. It's just what we're doing about it and how it's impacting our communities. And so I think when Tom and I were here last winter, we talked about Arlington does not have a super high crime rate for burglaries, but please don't let that fool you into thinking that drugs are not being, and I'm sorry if the collaborative thinks I'm always the downer at these meetings, but they're being moved through this community, and that's what I was hoping everyone here would have a conversation maybe with your other community members, because really the best eye for all of this is you all. It's, Tom and I in law enforcement, we're passing through, but it's really the community and the community institutions and the folks that live here that are seeing things that are out of the ordinary, or they're seeing maybe a family or friend that is struggling with opiate addiction or some other kind of drug use. And so just being able to have this conversation about the fact that this is not a drug that's just hidden in some urban area in some other place. It's here in Vermont and even in this community, so.
Yeah, I'd like to jump in there, because I actually think that brings it right. Even though you said you're the downer of the group, I actually think that you just made the most important message, and I would just say it in maybe with a more positive spin, which is there's nobody in this room that has not dealt with some loved one, whether it's a friend, a family member, who has suffered from some sort of addiction. Maybe it's someone who just smokes 5 packs of cigarettes a day. Maybe it's someone who drinks too much, but only on the weekends. Maybe it's someone who drinks daily. Maybe it's marijuana use, opioid use. It doesn't really matter what the drug is, but what it does matter is that when you love someone, there's nothing worse than feeling helpless. And I see that in the hospital every day. And one of the things that I really try and do when I meet patients and their families is really reassure them that there are resources. And I think that there are resources for help of both the patients, but also their families and friends. And I think that's one of the best things that could come out of this meeting is both an awareness, some education, but really just knowing that you're not alone and where to turn for help. It's embarrassing to talk about, a loved one who is suffering sometimes. People even as much as we really value honesty in general, the truth is that when someone you love is struggling, you don't necessarily want to tell the world. And so, and I see a lot of heads nodding in here. So I would say that, if you are a friend or family member or suffering from addiction of any kind, just know that there are resources and there are people in this room who have information for you, numbers to call and where to turn. When I first got a call from Kathy to come and join the group, I said, I only see people in the hospital when they're at their sickest. And I may not be the best person to talk about the day-to-day, but what I can tell you is I do know this community well, and there are some wonderful resources out there for those who really are struggling with addiction and abuse. And if you are looking for help with that, just know that whether it's going to your doctor, your nurse practitioner, your PA, the local health clinic, the urgent care center, the express care center, in Bennington County, there really is a great community, and we really do talk to one another and work together. And if you feel that you're not getting the help you need, there are patient advocates. So once again, I would really encourage you to seek help if you need it.
Okay, can I add to that? Please don't go home tonight and say, the principal of Arlington Memorial said there are no drugs in Arlington. I don't, there are drugs everywhere, people. But just for example, finding out today, I didn't even know what the Juul vapor thing was. Okay, it's very alarming to me and the staff now because that's nicotine and it's addictive. So if we have a 14-year-old who's sneaking into the bathroom with this little vape thing, you know, they're becoming addicted, and that's alarming. But please don't go home tonight thinking, you know, there's no drugs in Arlington, because I know that's not true. And last year, I had a custodian come to me near end of the year and say, I need to show you something. And we actually now have cameras now, which is really nice. We have 15 different angles so we can track things. But I walked up and on a windowsill was a small little baggie. I've never seen one so small, with a white powder in it, sitting inside the school on a windowsill. So I carefully, you know, I've never seen it before, carefully put it in another baggie, got it to the state police, they tested it, and it was a form of crack cocaine. So that was alarming to me, spending, you know, that was my 30th year in that school. That's the first time I remember seeing a drug like that. You know, we've had cases of beer out in the parking lots through the years, you know, the marijuana smell, you know, what the kids look like with their eyes, but to find a little baggie, you know, what if a sixth grader happened to come upon that and just, you know, tested it or did whatever? That's alarming. So I just wanted to add that.
I think one of the comfortable things about living in this town is that we have a sense of community here. We've always had. I've only been here for 40-some-odd years, so I'm not a native Arlingtonian, but I've raised 3 children here and a number of grandchildren here. And, you know, if somebody's house burns down, before the first ember is out, there's somebody that's putting together a fundraiser for that family. If there's a death in a family of somebody in this community, and when I say community, I'm including Sunderland and Sandgate as well, before the first tear hits the floor, there's a knock on the door with somebody with a casserole dinner. We care about each other, and this is one more thing that we need to care about. And Tim, I'm glad that you mentioned that about you know, I never said there was no drug. But you're here because you care, not because, and we can look at those statistics and say, wow, we're in pretty good shape. Well, if we were in great shape, we wouldn't be here. We're here because we're concerned, we want to know. So keep those questions going. We've still got about a half hour.
First of all, I think it's wonderful we have this many people who have come tonight. It's been a busy week for Arlington. And secondly, I think the most important thing we can take away tonight is communication. I work with a youth group and I substitute in the high school. And I've done a little survey, and communication is necessary. Fentanyl, how many, raise your hand, how many of you are familiar with fentanyl? It was primarily used by veterinarians, and it's a horrible situation if it's misused. It's 50 to 100 times stronger than cocaine. Anybody know that? And an overdose for fentanyl is different than it is, so much more is needed to bring somebody back from an overdose of fentanyl. And it is becoming a popular drug of choice. Now, I did a little survey of 30 students, and of the 30 students, only 13 were familiar with fentanyl, how dangerous it was. Only 9 of the 30 knew how dangerous it was. Of the 13, of the 30, only 13 had had any communication with their parents of any value, they said. About drugs? About drugs. And And so this is what we need to do as a community and as parents and grandparents. Talk to these kids, read up on what is happening, the newest drug, as Tim had said, the little tab. It's very tiny. It's hidden very easily, and it's disguised. There's no scent to it, but they're getting addicted to nicotine, and then sometimes fentanyl is being laced in with it as well. So Kathy told you about the sign-up sheet. Sign up and let's keep communication open. And I think, in answer to your question, that's what I hope we all take from tonight's.
There was a question in the front here. What does fentanyl look like?
Yeah.
Dr. Sherman want, or Tom, anybody want to take a stab at that?
What I see in the hospital probably looks very different than what is used on the street, so here we go.
So it comes in several different forms. It can be a liquid, it can be a powder, just like a cocaine base. It's more or less like baking soda. Or they come in fentanyl patches for somebody who has chronic pain and might be suffering from cancer and be a cancer patient. And it comes in a patch that you would wear on your skin. And it would be time released, correct?
Yeah.
That's what it looks like. But a far less amount to get the same high as heroin or cocaine or Oxycontin or anything like that.
Can you just talk about how it's in heroin? That's how
Yes.
we don't see pure fentanyl a lot, but it's in heroin or it's in marijuana.
Prior to coming to Shasbury, I spent my last year with the Drug Task Force, and 2 years prior to that with the Drug Diversion Unit, which does prescription crimes. And I can tell you that almost every time we purchased what we thought was heroin, it was actually laced with fentanyl. So we were actually purchasing fentanyl when we thought it was heroin. It's a much cheaper product. It's easy. They buy it in bulk over the internet or smuggle it from overseas, but it's a lot cheaper than the actual heroin. And and somebody in the back said it, the doctor said it's 80 to 100 times more powerful than heroin.
Is there any correlation with the Take Back Drug program? And because I know people, my name is Celine, I'm on the squad, but I also live in Arlington. Is there any correlation with the Take Back Drug Days where you can take your prescription drugs with a 60 oxycodone and get rid of them? Because are there like break-ins, people breaking into homes of maybe elderly who they know has had a hip replacement?
Yeah,
or grandkids, kids taking those medications?
Many of the crimes you see in the state of Vermont are because of drugs.
But the prescription drugs, sorry.
Yes, that's why burglaries happen. That's why your tools are taken. They're sold for prescription drugs or actual drugs.
Can you remind us, Tom, where people can dispose of legally their drugs?
Yes, where's the person from the collaborative?
So there's 5 locations in Bennington County. Hi, my name is Victoria Silsby. I'm the Community Outreach Coordinator at the Collaborative. There are 5 take-back locations in Bennington County, starting with the Bennington County Sheriff's, Bennington Police Department, Manchester Police Department, Winhall Police Department, Southwestern Vermont Medical Center, and there's one soon to be opened non-law enforcement take-back in Manchester.
Did we have the pharmacy or Rite Aid participating in that as well?
The pharmacy Manchester location is looking into being a take-back location. Also, is anyone from the Sheriff's Department here? I believe the Sheriff's Department will do a pickup at someone's house with an appointment if the person doesn't drive or can't drive, or there's been a death in the family and there's a lot for that family to cope with. The Sheriff's Department will do a pickup.
All right,
Hi, I'm Mary Ann Larson, the Executive Director of the Collaborative. And Erica, I don't think that you're always the downer. Sometimes I have to think about that too. I look at numbers from around the state on the Youth Risk Behavior Survey, and it has always popped up that Arlington has these really low numbers. But as you indicated, Tim, things can happen in a heartbeat, and you don't know when something's going to flash into a trend. Like with juuling, we're seeing around the state, really specifically in Bennington County, a lot of increased use. The other numbers that I work with, the Youth Risk Behavior Survey is specific to middle school to high school. But the Vermont Department of Health has started a young adult survey, and it's every other year also. And what I've noticed in the young adult survey in Bennington County is that while the rest of the state has gone down in its heroin use rates for young adults, which is 18 to 27-year-olds, Bennington County has doubled in the last 2 years. So I recognize that Arlington and Bennington County have a lot of assets, and clearly there's a lot of supports here in Arlington, and you guys care an awful lot, and that's half the battle, is making sure that there's resiliency built into your day-to-day assets. But I don't know enough about Arlington to know what are some of the supports for your young adult population in this community, is my question.
Is there anybody that wants to tackle that?
As far as supports go, starting last year, we had actually my first year as principal, we didn't really have any help from UCS in our schools. Now, for the past, the 2 years, at the end of this year, we've had a full-time UCS counselor. So between our psychologist, our UCS counselor, both of our school nurses, they're our major support right now.
But for a young adult population, so after even high school.
You know, one of the popular buzzwords that you might probably have heard if you watch the news is the concept of youth retention. You know, how are we going to keep our youth? You know, people growing up move away from small towns. Well, the truth is, it's not just a matter of youth retention. It's about really creating opportunities both in the workforce, in terms of homes and good living situations, in terms of basic things like dating and where do you go, or what do you do after school, or are there places to go? So I think that's, you know, I'm part of the, you know, as part of the school committee, but I'm also part of the Arlington right now is going through a real exciting moment where we're doing quite a few redevelopment, for lack of better terms. We're really focusing on both looking at who is out there in our community that can make a difference. And I think that is really important to sort of a larger vision. And so I don't think I can answer that question directly because once again, 18 to 27-year-olds is not the population that I typically see, although in truth, if a kid comes in having overdosed, sure, that's who I see. And, you know, and that's a difficult situation. I think that UCS, which is the United Counseling Services, is a really important resource to our community. I think that getting access to good health care, you know, one of the challenges with 18 to 27-year-olds is they usually are healthy, they usually are not insured, and they usually don't go to the doctor unless they're sick. So why go to the doctor if I don't need to? But the truth is preventive care is really important. I was a primary care resident, and establishing a relationship with a healthcare provider, once again, whether it's a nurse practitioner, a PA, a physician assistant, or a doctor, does make a difference. Knowing that there is an urgent care center when you need it. And so I think that building a society and a community where different things are available, jobs, homes, healthcare, all of these core rights that we really care about, I think that's really how you address the 18 to 27-year-old community. I also think, in all honesty, that it comes down to, I think social media is of course a huge issue, but the truth is social media can also be a great way to create awareness. I mean, as silly as it was, the Ice Bucket Challenge was an amazing way to create awareness for ALS. And I don't know if any of you got ice buckets over your head. I certainly did. But you know, I think but I think that what I would say is that there are ways of getting messages out there, and I actually think using social media, particularly for the 18 to 27-year-old group, would be a smart way of distributing accurate information and letting people you love know where to go.
One of the things that Bennington County does have for resources is a Suboxone program. Suboxone is a medication that we can give that is an opioid, but it makes it so people do not get the euphoria of an opioid, and it helps people to stay clean from heroin and fentanyl and those kind of drugs. So one of the problems in Bennington County was that there wasn't enough sites in order for people to get Suboxone. So at this point in time, UCS has a Suboxone program, Hawthorne on Benmont Avenue has a Suboxone program, Mount Anthony Primary Care, Shaftesbury Medical, and as of about 3 weeks ago, Till Valley. So we are trying. Obviously, with a Suboxone program, people have to want to get help. In other words, it's not something that the law enforcement can't force people into a Suboxone program. People need to want that help.
Yeah, just to clarify this a little bit, for those of you that haven't heard that term Suboxone before. So you've probably heard of methadone clinics. That was one of the ways that if people are abusing drugs, how do you help them transition out of this addictive behavior? And Suboxone is basically the most current method of, one of the methods of doing that for those who are struggling with addiction, who want help, or are mandated to get help, but I think usually there has to be a willingness, and what it essentially does is it does not create a high, but it does take away sort of the desire or the need, and it is a great thing that we once again have that available in our community.
While I'm walking over, Marty, you talked about the fact that you've only used Narcan once.
Yes.
Where is Narcan available, and if people then want to have it, where besides the hospital and a rescue squad would, and perhaps law enforcement carries it too, how would people access that if they were concerned about the possibility that a loved one may overdose? And they want to be prepared. Is that possible for the average citizen? Can they go and secure it for themselves, Narcan?
I believe that I'm probably not the right person to answer that, but maybe some other folks might be able to help with that.
I believe if you do want to be trained with Narcan, you can go to the Turning Point in Bennington, and Ken will give you a small training course and give you Narcan. Yes. Free.
Yeah. And I believe now that if you're prescribed an opiate you're also given a prescription for Narcan. Is that correct?
I don't believe so. I know that once again, that's a good question, and I'm the wrong guy to answer it, but I think she can.
Yeah. The state just passed a law that if a practice is giving the same patient an opioid and a benzodiazepine like Valium or Ativan or one of those, if you're on those two medications, then we have to, by law, give you a prescription for Narcan. But if you're just on an opioid or just on a benzo, then the state law currently is that we don't have to. We do, on quite a few occasions, we give people prescriptions for Narcan. My experience is most of the time when I call them up and say, I've called you in some Narcan and it's at your drugstore, I get kind of laughter. You know, I don't have a problem. Why would you do that? So.
It's unfortunate.
Once again, I always think that education is always the basics, and I always one of the things that the average literacy rate in this country is 8th grade, so most people read as well as an 8th grader. But the average health literacy, in terms of how well people understand the healthcare system, is actually and healthcare in their bodies is actually 3rd grade. So whenever I hear big words used, I always take it back. So Narcan, for those of you that don't know, is a drug reversal. So if you should find someone who is overdosed, or if you have mistakenly overdosed, it is basically a way of temporary reversing so that you can get help. And that's why it would potentially be prescribed in association with painkillers or other medicines that might make you sleepy or get you out of it.
You know, it used to be to think a small town like ours, that you wouldn't find this sort of thing, and it's very, very disturbing. You look on TV today and you see kids down in New York City with gangs on the corner passing out dope like it's a candy bar or something. And you say to yourself, well, how the heck do these people get this stuff into our areas? I guess it's pretty prevalent that you can go any place around and you can always get, I guess, what these kids are looking for. And it may not be just the kids, it could be adults doing this stuff too. We blame it on the kids, but you know, there's both ends of this thing. Is there any way that we as citizens here can help the police without breaking their backs, spending them all over the place to try to make them aware of certain areas, or you know, what do we look for to try to help you guys?
You know, one of the things that I used to do a few years ago is I would have to go around and talk to prescribers and physicians and pharmacists and such was part of my job. And one of the things I would always tell them is be confrontational. Now, I don't mean physically be confrontational, but be confrontational as a parent or as a neighbor or as an adult. You know, ask those questions. Have those doctors should be asking the questions of those patients so those drugs aren't abused and diverted into wrongdoing. So keep your eyes open, say something, let us know when you see something, and be confrontational. Ask questions.
And the only thing, we don't want to send you guys all over the place with false alarms either, you know?
True, but I think when you get a series of red flags, that's when you make the phone call.
Can you talk a little bit, maybe Marty, you can talk about what is it when you suspect someone is overdosing, what are you seeing? So if I happen to be somewhere and I think that a person is overdosing, what am I looking for?
Mostly unresponsive, very shallow respirations, pretty much, passed out. They're circling the drain, as we would call it.
And how long typically does one have before one has to get help before it's not going to work?
I don't think there's a defined time, but obviously the sooner the better. You don't have an extended long time. It needs to be relatively quick.
I'm wondering if somebody can speak to any correlation, I don't know if the Department of Health or Martha, if anybody can speak to legalization of marijuana in the midst of this addiction epidemic. It seems to be this massive contradiction. That's very frustrating to me, personally. Anybody want to talk about it?
I would love to talk about it.
Thank you, Eric.
Unlike Tom, my bosses who elected me, and I completely agree. It is a mixed message at the very basic elementary school education. I have 4th graders that will confront, police officers. Why are you even bothering with, marijuana? Who cares? Isn't it legal now? One thing I would point out, and I was hoping Tom would mention it, was fentanyl now is also in marijuana. That's something we've just seen popping up in some of the schools in this county, where we're catching people with marijuana that have fentanyl in it. To me, it's the basic hypocritical message that we're sending, right? It's okay for an altered state in some situations or in some cases, but it's not in others. And we've decided that marijuana is okay and heroin is not. What I get frustrated about is I understand. I just enforce the law as, like, I don't go up and speak at the State House about this. It's not my place. My job is to enforce the law that I'm told. So if the people in this community have opted for legalization, that's their right. And it's not my responsibility to say, well, I disagree with you, so I'm going to do something different. I have to follow what the law says. However, what I think is disturbing and that I don't think was really fleshed out during all of the discussion of legalization was that the very vocal population for legalization are the people that are my age, have jobs, they're otherwise completely responsible, they just want to have, a joint after work. It's what's the difference? I can go home and have a glass of wine, why can't I smoke pot? The difference is a large number of the heroin traffic stops that I see also have pot in the car. So it's not, we're assuming that pot users are of a certain type, right? They're going to be responsible, otherwise responsible. Maybe they're, just people that think it's a healthy alternative or natural alternative to some other type of drug to alter your feeling. But it's just, I do think it's hypocritical, and I think it's a slippery slope. Now, did I go and testify to any of this? No, because I don't feel like I should. I don't feel like I have the right to go and say that to, if there are huge numbers of people, all of the legislators that are in Montpelier that are making their case for it and talking about how much money we're going to make on it. Not, right? It's not taxed. So right now, what we have with legalization is you can grow your own, a couple of plants, you can grow your own. You can possess a small amount. There's nothing that enables you, nobody can sell it though. It's still illegal to sell it. And the state's not selling it, so they can tax it. So I'm not sure where all the revenue that everyone's talking about is coming from. It's not in the legislation they've just passed. So I find that kind of disturbing and a little stressful. But I was hoping Tom would talk a little bit about, it came up a little, where are these drugs coming from? And I think that everyone would be a little shocked. We're all kind of talking a lot about prescriptions, but the drugs, the heroin that we're seeing that's in the community is being sold, and a figure I heard from actually one of the majors that testified about this topic a couple of years ago said 80% of the drugs, the heroin being sold in Vermont is being sold by Vermonters to other Vermonters. And I'm not sure if Tom has more information about that. I think we kind of all assume it's the big bad out-of-state person that's coming in and bringing in all of our drugs. And in my experience and the information I received, that's not it.
I would agree with that. In the 3 years I've worked with the drug unit, the majority of our drug sales, smaller drug sales, were from local residents. Now, the source cities that we have are Boston, New York, Hartford, Connecticut, Springfield, Holyoke area. That's where the drugs are coming from, but we're seeing many Vermonters travel out of state to purchase those illegal narcotics and bring them back. I would agree with Erica. Probably 75–80% of the drug sales we have in the smaller amounts come from local Vermont residents.
I'm not speaking for Dr. Levine, who is the Commissioner of Health, but I do work for the Department of Health. As you know, on the Department of Health website, there is a very extensive data brief or data document that the Department of Health wrote for Governor Scott weighing in on legalization of marijuana. Knowledge is power, people, okay? People have said this here before. It is important to do some reading. It is important to start getting on, we have a lot of resources on the website. Do the reading, educate yourself. Don't let anybody else tell you what you should or should not think. Get the facts. So if you cannot, the Department of Health website was redesigned last year to make it more user-friendly. It took me a year to figure out where everything was, and I work for the Department of Health. So if you're ever having a hard time finding, if you are interested in looking at this data document, or if you're having a hard time finding anything on the website with regard to anything that was spoken about tonight, please, 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 our Office of Local Health is in Bennington. You can just get on the phone, call the main number. Our very nice front desk people will figure out which nurse, which analyst that you need to talk to. If I don't have the answer for you, I can get the answer for you. One other thing I wanted to say, I want everybody to be aware that there is a DSM-5 diagnosis, cannabis use disorder. It is possible to abuse cannabis, just like it is possible to abuse opioids or alcohol or anything like that. Just because you have a drink doesn't mean you're abusing it, but there is always, in some people, there is that potential. And that's what you should know.
I think we have time for one more question. If you have a burning question, please raise your hand. Right here.
I don't have a question, I have a statistic.
Great.
So I have to look at my phone because I just can't remember all these numbers. But I'm Paul Diano, I'm the Division Director for UCS's Outpatient and Substance Abuse Services Mental Health. And one of the statistics that you can see at the Vermont Department of Health website that is just alarming to me, and wherever I go when I'm working with folks here or I'm at one of these, I feel like it's important to bring a statistic to your attention. It's about the number of people that we keep track of that seek substance use services around the state, under 18 and 18 and older. And we're a preferred provider, and we're supposed to send data in every month. Everyone that comes into our facility that wants substance use services, 12 or older, that data is reported to the Vermont Department of Health. And that's how they get all these wonderful graphs and all these wonderful statistics around substance use treatment. If you go on their site, you can find this one particular graph, and it is called People Treated for All Opiate Abuse by Age and Fiscal Year. What's alarming about this to me, and I've been carrying this around with me for a couple of years now and bringing it up, is that the number of people under the age of 18 that got treatment in a preferred provider in our system. That means they went to UCS, they went to Rutland Mental Health, I'm not sure if Valley Vista reports say this data or not. Between 2006 and 2015, over that span, less than 300 kids under 18 came in for treatment. Between 18 and 24, over 7,000. Now, I don't know what we can do with that, but that tells me there's a serious problem. It's probably starting before age 18. There are substances and drugs, of course, we know, in schools and around. So some of the data that we see can be misleading. This is really alarming to me. I'm a licensed alcohol and drug counselor. I've been doing this for 15 years. I'm on the treatment end of things. It certainly tells me that we need to be doing more around education and prevention. And that when you have that many people coming into treatment after the age of 18, it's just alarming. Over 7,000 people are walking through a preferred provider network to get substance abuse treatment. Only less than 300 for a 10-year period. So that's an alarming statistic to me. I know we have some other people in the audience here that are much more experts in education and prevention around substance use. But one of the things that I hear a lot, and you've heard this too, and I don't mean to offend anybody, but we hear a lot about how we're not going to jail our way out of this problem. You've heard that before? We're not going to sober our way out either. There are lots of options for treatment. And I was on the OCC Council, and I saw those recommendations to Governor Scott, and they were very good. There's a lot of treatment, MAT, residential, recovery housing, there's lots of things going on. But we need to focus on this before these 7,000 people start walking through our door. And this doubles when they get to 24 and above. So that's just what I wanted to say. I think it's an area that we need to really be working much more hard in, getting money for funding, getting programs. So that's fine.
Thank you for that. And I think that may be a starting point for our next time that we meet. And the question that I would ask you all to think about is, when is it time to talk to my child or my grandchild or my neighbor or my husband or my wife or my brother or my sister? When is it time to start this conversation? I would say the answer is simple. It's right now. But I would ask you to think about that. And when we come back together, we'll have what we would like to do is to begin to have you folks work on what's your main concern for our community. So thank you all for coming. I'd like to thank the panel. I know 2 people were unable to attend for various reasons, but I want to point out one person in the room, and he probably doesn't want to be pointed out, but it's Colonel Jim Baker, who's heading up the Arlington Renewal Project. And this conversation has also come out of a conversation from your meetings. And if anybody would like to be part of that discussion, not only about this topic, but other topics, I'm sure that Jim would be glad to hook you up with one of the committee chairs in our community. But so thanks for the panel. Thank you for the use of the church. Thanks for the collaboration, the Nursing Association for the refreshments that are out there, and I'm sure folks will be willing to stick around if you would like to ask some more questions, but it is past the hour. So thank you again for your attention and your concern.